Perform hand hygiene. Identify the patient. Ensure privacy. I'll place the thermometer under the tongue of the posterior sublingual pocket. I'll ask the patient to hold the thermometer with their lips closed. I'll keep the thermometer in place until the unit beeps. Then I will carefully remove the thermometer. Remove the discard plastic sleeve cover in an appropriate reciprocal. Read the thermometer at the eye level. Wash hands and document my findings. If I were taking an anal temperature, I will assist my patient in a slim position with their upper leg flexed. I will lubricate the thermometer and place it in the patient's anus about 1 inch. Keep the thermometer in place until the unit beeps. Assessing respirations. Because respirations can be controlled voluntarily, it is important not to tell the patient you are doing it because they are apt to alter the breathing in response, even subconsciously. Therefore, it is the best to count respiratory rate when taking the pulse. Note depth and rhythm of respiratory cycle. Discuss findings with patients and document respiratory rate, depth, rhythm, and character. Obtaining a radial pulse. Perform hand hygiene. Identify the patient. Ensure privacy. Position patient comfortably with forearm across the chest or at the side with wrist extended. Place fingertips of your first 2 or 3 fingers along the groove at the base of the thumb on patient's wrist. Press against the radial artery to obliterate pulse, then gradually release the pressure until the pulsation. Assess for regulatory and strength. If the pulse is not easily palpable, use Doppler. Count the pulse for 1 full minute. Count the initial pulse as 1. Obtaining an apical pulse. Position the patient in a supine or sitting position with the sternum and the left chest exposed. Warm diaphragm of the stethoscope by holding it in the palm of your hand for 5 to 10 seconds. Use an alcohol swab to clean the stethoscope and the earpiece before using it. Locate the apex of the patient's heart by palpating the space between the 5th and the 6th rib, 5th intercostal space, and moving to the left mid-clavicle line. Insert the earpiece of the stethoscope into your ears and place the diaphragm over the apex of the patient's heart. Assesses the heartbeat and for irregulatory and dysrhythmus. Count for 1 full minute. Count the initial pulse as 1. Obtaining blood pressure. Perform hand hygiene. Identify the patient. Ensure privacy. Assist patient to comfortable position with forearms supported at heart level and palm up. Expose arm completely. Palpate the brachial artery. Wrap deflated cuff snugly around the upper arm with the center bladder over the brachial artery. Palpate the brachial artery or radial artery with fingertips. Close valve on pressure bulb and inflate cuff until the pulse disappears. Slowly release valve and note reading when the pulse reappears and note this number. Deflate cuff. Close bulb valve by turning clockwise. Ensure gauge starts at 0. Pump bulb to inflate cuff. Inflate cuff to 30 millimeters mercury above reading where the brachial and radial pulse reappeared. Open valve on manometer, then slowly release valve so pressure drops to 1 to 2 millimeters mercury per second. Identify manometers reading the first clear sound is heard. Continue to deflate the note reading sound disappears. Deflate cuff completely and remove from patient's arm. Document your findings.